Hello, my name is Dr. Christy Dean, and I am the CARI Committee Chair. The presentation you are about to hear is from our Chancellor, Dr. PeterChris Okpala, regarding amino acid disorders. Prior to hearing from our Chancellor, I would like the team to introduce themselves, starting with Dr. Jimerson, as Dr. Waller is on holiday. Dr. Jimerson.
Good evening, everybody. My name is Dr. Deontay Jimerson. I'm part of the education department, and I've been working here for, I want to say 2 years maybe. And that's it. Nice to meet everybody.
Dr. Chikwaka.
Hi everyone, my name is Dr. Chinyere Okpala Chukwuka. I am the Dean of the School of Law and also the Ethical Chair Committee. I have background in law. I'm an attorney at law, and I have my PhD in law, master's in law, and I've been practicing before I started doing this. I'm a researcher and an author. I've written so many books and I'm focused on terrorism and counterterrorism. Considering the modern things going on in the world right now. So today, I'm so glad to be part of this CARI theme, and I'm so glad I'm going to be here to listen to this presentation, and I encourage everyone to join us and listen. And I'm so happy I have my staff here. I have Dexter Todd and Paula Butu, who are also in the School of Law. So I'm glad they're all here today. Thank you.
Hi, everybody. I'm Dr. Veronica Butera, and I am a member of the business team here at Charisma. I've been here at Charisma for just about 2 years now, and I've had approximately probably about 12 years in higher education. I do have my doctoral degree is in higher education, is the emphasis with my doctoral degree. I also hold master's degrees in finance and marketing, and I am a lead faculty over the marketing program with the business group. So I'm really pleased to be here with the CARI presentations and a member of the CARI team, and I'm looking forward to lots of good things to come with this team. Thank you so much.
Thank you. I am Dr. Ann Wade, and I'm the Executive Director of CARI. I have the pleasure of doing that as well as being the Dean of Education and the VP of Training and Accreditation. So I wear many hats, which I love all of them. My interest has always been in education. I've been in education for 32 years. My doctorate is in educational leadership. I have another one, a PhD in criminology. So I'm interested in crime and all the things that go with it. So we'll ask that everyone, if you'll turn your mics off and your pictures, and Dr. Okpala, we are ready for you. Very excited to have you as our first presenter.
All right, okay. All right, thank you everyone, and thanks again for this opportunity. If you don't mind, let me try to share my screen, okay? All right, guys, so again, welcome, and I'm glad to be the first one to present here. So it's a privilege and also an honor. Today's presentation is gonna be based on amino acid disorder. And this topic is a little bit unique and a very special one because we're gonna be discussing amino acid disorder that is mostly based on genetics, So this is a type of genetic disorder that we see that is caused by gene mutation. And therefore this is genetic. So I'm gonna explain to you guys what this Cystinoria is all about, how we can manage this. Unfortunately, there is no cure for this, but we can manage this. We can arrest this at early time and allow the patient to live and control this type of disease. All right, so while this is a genetic disorder, again, is something that will be passed on, family to family, right? Family members. And why is this considered to be a genetic disorder? First of all, we do have genes that will normally function well. And whenever a gene mutates, right, it could result to something that is very abnormal. So with this type of stuff, with everyone has cysteine, by the way, and yes, it's amino acid, and usually you don't have to have deposit of it so much in your kidney. This is supposed to pass through the kidney, pass through the bladder, and then kind of go back to the bloodstream. Now, with this kind of mutation, it doesn't really pass out, it stays and it forms the stone. So the amino acid I'm talking about here is the cysteine, and when two of them are combined, they become this cysteine, right? So, and then they stay and then they form the stone, and then that's why I call it Cystinoria. So it's abnormal, high level of cysteine in the bladder or in the kidney. It stays there, it doesn't pass out, it stays there, it forms the stone. So this study will obviously walk us through on how to manage this. And this study will focus on two ways we can manage this, either pharmacologically or non-pharmacologically. So again, this is a real type of disease. And well, I took interest to study this because even though it appears to be a real type of disease, the complications are, kind of deadly, especially on children. So we're gonna learn about how to manage this and begin to recognize this. This is a systematic review of already conducted research on this very topic. So I kind of reviewed a lot of articles, peer-reviewed articles from trusted peer-reviewed journals and the incredible newspapers and the magazines. We do have side effects, how we can, not side effects, but symptoms, how we can detect this. But I don't want to mention about this now. It's just an abstract. So I'm going to go in detail so we can try to explore more on how we can, discover the signs and symptoms and be able to handle this on our patients. The clinical significance of this research. I know there's a question from one of the committee members from Dr. Chukwuka asking about this. So these are the clinical significance of the research. One, this research will help us to diagnose the patient, treat the patient, at the earliest time, not allow this to, to linger and to stay and cause more complications, right? So we're gonna, when we discover this, we'll be able to arrive, in a better outcomes. Complications, of course, will be reduced, and everyone will be informed that this is actually a type of genetic disease that we usually see that result in kidney stones. All right, so let's go in details here. So, well, it's a rare disease because this is about 1 to 2% of kidney stone disease that we see in America today. We do have different types of kidney stones, and a lot of people have been suffering in different types of it, right? But this one in particular is genetic type, that there is no cure. It must continue to happen, and the only cure will be just to learn how to manage this, right? Now, for men, the men are more vulnerable to get this type of disease than females. Now, when this disease gets into children, it causes more risk than adults. So here we have more complications in children, about 6 to 8% more adults. That is how, this becomes more scary, right? We do have renal calculi complications, and this renal calculi complications is something we call hematuria, so blood in the urine, right? when we have this high level of cystine that has formed this stone in the kidney that has blocked the ureter, causes pain near the abdomen or groin. And again, patient that has been in this kind of complications for too long could start to sense blood in the urine, right? Well, the most scary part of it is that someone could have these complications without feeling all these pains for 10 or 30 years, right? So again, that's why most people today, they ignore this type of disease, but we need to be mindful about this and work towards helping those that are rather facing this kind of genetic issues, right? All right. So again, with how I collected my data here, they're all based on peer-reviewed articles, ebooks, government and non-governmental reports. These are trusted articles, trusted books from the government. And again, I gathered information about these books by utilizing key phrases. I was able to search online, how can we manage this? How can we attack this pharmacologically? How can we do this also non-pharmacologically, right? So these are the two ways we can do this. When can we do follow each of these approaches in handling this type of disease? So in doing this here, so let's discuss about the pharmacological management of cystinuria. Anything that has to do with pharmacology, it's all about drugs, right? It's drugs. So this is all about drugs here. So there are different types of drugs that physicians have used or can still use to manage cystinuria. And then this type of drugs are the one that is cysteine binding thiol, and that includes D, penicillamine, piperine, captopril, and busilamine. Now, D, penicillamine appears to be the most effective one. However, it does have more complications, right? But what this medication does is that it helps to minimize the solidification of cystine in the kidney. So rather than cystine stay in the kidney and trying to crystallize itself, trying to solidify itself and form stone, this medicine will prevent that. In other words, the medication will make the cystine to be more soluble, so it can be passed out. That is what this medication does. Now, this medication has very high side effects. Very, very high side effect of it. Because one, if you don't control, if it appears that the patient will take high dose of it, it's gonna be, of course, high dose will be more toxic to the patient. Again, the most scary part of it is that this medication has been found to cause autoimmune disorders. So the immune system will begin to attack your healthy cells, right? So while this is very effective in treating this, the side effects are not really appealing. So let's look at other ones here that physicians have used and are still using that. The other ones, the other medication is the piperine. Piperine is also cysteine binding, thiol, as we discussed. And again, it functions the same way by preventing the solidification of cystine in the kidney, right? So this is okay. With what they have done here, the side effects of this one are different from the other one. These are side effects. These are also very effective, but this has side effect that has to do with something so different from the other one. This one, you're gonna have, bloating, swelling of the face, abnormal discomfort, unusual weight loss, blurred vision, and irregular heartbeat, right? So let's talk about this one. This one appears to be the most preferable type of pharmacological management of this cystinuria. And this is the captopril. Captopril will function like the other types that we have just mentioned, right? Yes, but this has no side effect. This actually has been seen to be more effective, because when you look at the percentage of the effectiveness of this, you will realize that this medication appears to be the solid one. There is no side effect. It has more high effectiveness when you compare it with others. So captopril is actually the best way to handle this pharmacologically. Okay. All right. So let's look at other aspect of this here. This is very interesting here, that we can also manage this in a different way now, something that we could call home medicine, right? Your goal now is to alkalinize, the urine, so meaning that, you're gonna be turning the pH levels now, right? From acid all the way to basic, So now, why do you have to do that? You are moving pH from acidic to basic, because why? You know that on the alkaline level, right, the cystine is more soluble compared with acidic. pH of 1 to 6.9 is considered to be acidic. pH of 7.0 all the way to the end is considered to be what? Basic, so more alkaline. And you find that cystine can be more soluble on alkaline, right? So how do you do that? Just a simple home medicine, right? Homemade medication or homemade therapy, we could call it. Sodium bicarbonate, you can just drink that, or potassium citrate, you can just drink that, and that helps to alkalinize the urine, so that the cystine can be more soluble, right? Yeah, it is still pharmacological because it is considered to be a therapy, it's a medication, it's a drug. We are mixing something, even though we could do this at home, but this is still considered to be pharmacologically, okay? Now, let's look at this when this pharmacological fails, right? Even though I'm still going to talk about the behavioral management of this type of thing, what we do every day to manage this cystinuria, but let me address these surgical therapies. Now, assuming that everything that we have done for the pharmacological has failed, if we have done everything we could and still the complication stays, and everything has been there, and there is nothing, patient is still in pain and stuff like that, and then maybe hydration also did not help, this is the time to consider about surgical therapies. There are 3 types of surgical therapies in this type of situation, and each of these type of surgical therapies would function on a certain way, and there is a reason why you have to use each of these therapies. Okay, we're gonna find out one. There's a therapy, there is one that will be used only if you know that the kidney size would handle it, right? So there are different sizes of kidney stones, right? You could have from 1 all the way to 20, or even larger than 20, right? Now, surgical therapies, the 3 types of it will not handle all the sizes. So you need to know which one you are using, all right, that will handle the specific size. So let's talk about this now. We have number 1 here that we call percutaneous nephrostolitotomy. So this surgery is basically on the skin. So the physician will normally, the surgeon will normally pass a special instrument, all right, on the patient's skin, and then that goes to the kidney, and it's gonna help to break the stones, basically. So we break the stones so that to be able to pass, right? To be able to pass through the urine, and then, they're gonna drain it out, that kind of stuff. Now, with this surgery, work with all different sizes. That size, no. This surgery is only good only if the size of the kidney, if the size of the kidney stone is larger than 20 mm. 20 millimeter. So if this is less than 20 millimeter, this type of surgery will not be able to break anything because it's not going to be able to detect it, right? When you pass that thing through the skin, right? So as with other surgeries, this will carry some complications as well, right? And from my research, it appears that this complication is about 15.4%. Okay, so let's look at our other three types of surgeries that we can do. The second one we could do is the ureteroscopy surgical procedure. Now with this one, we pass the instrument into the patient's bladder and then into their urethra to drain urine, all right, to remove the kidney stones. This type of procedure will only be effective on the stones between 12 to 20. The other one we discussed is gonna do 20 and above, larger than 20, right? This one is gonna do 12 to 20, right? So this is good, but the complications here is 23.8%, all right? Now let's talk about the one that will do lesser than 12 mm. The lesser than 12 mm would normally be the extracorporeal shock wave lithotripsy, ESWL. So this will work with on kidney stones that are smaller than 12 mm, right? And this also has lesser complications compared with others, 11.4%. So it also, what surgical therapies are you gonna use will depend on the size of the kidney stone, right? That's why sometimes you see some errors in this kind of surgery where a physician or a surgeon had assumed that this is the number of, so this is the size of the stone, and at the end the patient continues to suffer from kidney stone. I mean, they're still gonna suffer, but at least the purpose of this is just to control the pain, at least, to relieve the pain, that kind of stuff. But at the end of the surgery, there is no outcome, nothing was achieved, so it means that the wrong surgical therapy was used. And that is because the physician or the surgeon was not able to determine the size of the kidney stone, right? All right, so we do have a way that we could remedy this situation, assuming pharmacological, non-pharmacological, the pharmacological one or the surgical one will not work for any of us anyway. This is actually what we do every day in our daily lifestyles, how to control this. Everyone has been told one time in his or her life, you need to drink a lot of water, right? Make sure you hydrate yourself. And the reason is because, water is basically the main source of life, not even food. Because with water, in our system, the pressure is maintained, right? Low pressure can really trigger the whole thing, in our system to go worse, that kind of stuff. Again, hydrating ourselves help with digestion. It helps to break down stones, and we don't really realize what fluid does in our system, but this is one of it here, so it helps to break down stones. And then this is a recommendation here. First of all, make sure you hydrate yourself every single day, and before you go to bed, take at least 500 ml of water. Usually a bottle of water, just a regular bottle of water, is considered to be 500 ml, right? Before you sleep. And if you would wake up overnight or midnight, try to take maybe half of it, just to maintain the cystine levels in your urine. The goal is this has to be under 300 ml, right? And so when a patient is diagnosed of the Cystinoria, this would be the easiest thing we could tell the patient: hydration, hydration, right? So let's talk about other ways we can do this also. How about the diets, right? How do we modify our diets here? How do we control or decide the food that we eat that will not trigger the cystine to go high, or So let's look at this here. This is the advice here. You have to consume low sodium and animal protein foods in your diet, right? And that is because, this is gonna help. Like I said, the cystine is supposed to pass through the kidney, pass through this thing, and then leave and then reabsorb back again in the bloodstream. But with those suffering from this, it stays. It doesn't pass, it just stays, it doesn't re-enter or anything, it just stays, and then when it stays and it meets other cystine, they combine and become cystine, and that will eventually form the stone, right? And again, when we have high level of sodium in our food, this is just generally for those that are in this category, okay? And then a high level of animal protein in our food, for those suffering from the Cystinoria, it doesn't help them that much, with their condition, Again, when you have, when we have low animal protein, right? It increases this thing that we did before, the alkalinization of the urine, right? So high rate of animal protein will reduce the alkalinization of the urine. So instead of going towards the alkalinization, side, it's gonna be going down to the acidic side. And you know that acidic pH will not be soluble for cystine, right? So that is what the animal protein, high rate of it will do for those in this particular condition. Now we look at also daily stuff that we normally practice, right? We eat peanuts, broccoli, mushrooms, all this stuff, right? Well, unfortunately for those in this condition, that might not really work well for them. So they need to limit this type of food, and then in that case, their cystine level will be reduced. All right, so the question again, I think I was reading from the committee. The question again is, do we really have to medically treat this or completely? The answer is no. This has no cure, unfortunately, but we can control this. We can prevent the complications from happening in the first place, but we cannot really cure this type of genetical disease, and that is why physicians are trained to educate family members about this. We need to understand the signs, the symptoms, which I mentioned earlier. We also need to understand the medical approaches we could take in treating this, whether it is pharmacologically, whether it is non-pharmacological, right? We need to know that, right? So also we need to understand the symptoms when someone is complaining about this cystinuria. We need to basically understand what symptoms are. Like I said, if complications will not be treated right away, it could result in so many things. The kidney could be damaged, basically. The ureter could be blocked, and all sort of stuff. This is not healthy for the patient. So the earlier we address this, the better. So creating awareness, patient education, and letting everyone know that even though this is a real disease, right? Yes, it does happen, especially with children. These complications are higher on children. All right, so let's look at this here. What are my gaps here in my research here? I know we talked about different ways we can treat this, right? And if you are listen to what I just said about the side effects, we did not get much information about the side effects. Say, for example, we talked about bloating, we talked about swelling on the face. Now the question one would ask would be, how long does that last, right? Okay, there was no information about that. About the irregular heartbeat, right? What happened when someone will get that. Would that normalize after a few minutes, after a few hours, that kind of stuff, right? We didn't get information about that. How about the one that says, hey, if you take this, your immune system will attack your good cells, right? How long would that last? There was no information about that. So official researchers will need to focus on addressing the side effects in more details. All right. Now, we also need to understand about the long-term side effects of, say, if someone is living on this medication for a long time, right? What happens if there's no side effect yet, right? Is it safe to start this medication for a long time? We already know that this disease stays, right? We don't cure this, but we control. If someone decides to continue this medication throughout the lifetime, what happens, right? We don't have such information, right? All right. So again, with the medication aspect of this, what are the dosage for children, right? How about the adults? Okay, no information about that was supplied. So I think we need to know that so that we can be able to know how to handle this, right? All right. So if there is any other ways we can handle this, I know we have our where we can do this hydration and stuff like that, right? What would be another conventional treatment method that we could use to handle this, right? We didn't see much, anywhere. So now the questions that would trigger further research on this topic would be, will the practitioners, physicians, are they going to be able to incorporate health informatics in managing and treating cystinuria among adults and children? Now, will they focus on health education to facilitate early diagnosis and treatment of cystinuria among adults and children? So, I believe that these two questions will obviously facilitate evidence-based cystinuria treatment, will help to assess quality and timely care among adults and children, and will reduce medical errors in caring for individuals with cystinuria. So in conclusion here, this cystinuria, first of all, is a genetic disorder. So this is not seen in everyone here, and this is a real disease that that could happen just 1 or 2% in our population today. It's a genetic disorder because the two amino acids, amino acid cysteine, when cysteine combines with another cysteine, right, it forms the cysteine, which is normal, right? And the cysteine is present in everyone's, system. It's supposed not to be retained in the kidney, right, or stuff like that. So with this genetic disorder, it doesn't pass out. So it's the gene will rather mutate, and they will mutate, and they're gonna cause this kind of stone, because they combine together, forming the actual cysteine that we call cystinuria. So they form cysteine, and they don't pass out. Nuria is something that is not kind of good, right, in the system. So the cysteine becomes something toxic to the body. So it becomes cystinuria. It stays there and forms the stone. It blocks the ureter, and then if this continues, someone could have blood in the urine, something we call hematuria. And of course, there will be pain near the abdomen or groin, right? Now, if this continues, again, it's gonna block the ureter, and then UTI infections, kidney infections, everything will start, to manifest, right? All right. So this study was based on the peer-reviewed, and we learned today how we can pharmacologically and non-pharmacologically manage this cystinuria. And the pharmacological that we discussed, cysteine binding thiol drugs, which we mentioned earlier, and also the urinary alkalinization, surgical procedures, and then for the non-pharmacological will be dietary modifications and hydration, right? So that basically ends my presentation. I hope everyone really enjoyed this. I know it's one of the topics that most of us today we don't really pay attention to that because it's a real disease, but it's a concern because when someone gets that, it becomes a problem. So thank you guys for listening to my presentation. If you have any question, I can answer that for you, okay?
Okay, Dr. Chukwuka has the first question. She's up.
Thank you, Dr. Wade.
Yeah, I'm here. But I think he has already answered the question. I wanted to ask him about the clinical significance of his study, but he already supplied the answer when he was discussing that. Except if he can tell me more or tell us more the meaningful of this research in curing this disease. Well, the few patients, there seems to be like rare patients out there. So has this your research helped in providing some kind of cure? Or you said it's not something that is connected, it's not something they can manage. So has this your research been kind of helpful with the patients that are suffering from this disease?
Yes, thank you so much, Dr. Chu. Yeah, this disease is not curable. However, we can manage it. It's a kind of chronic genetic disorder, that we have seen. And this study is actually purpose of this is to create awareness about this and to help patients improve, in their condition, because we don't cure this, right? So patient must know how to manage this. And I was able to describe several ways we can manage this, whether pharmacologically or non-pharmacologically, right? Patient must understand how to manage this. So it's just about creating awareness. Let us understand clearly that this thing happens, right? And it's genetic, and there is no cure. And again, if we have to use any type of approach to manage this, we must pay attention, right? Listen and pay attention to all the side effects, right? And see how you can handle this. If there will be a reason for surgical therapy, right? Which one are you using? How are you sure your physician knows actually the size of the kidney? I mentioned earlier here there are three types of surgical. There are three surgical therapies, but the one you use will depend on the kidney stone size. That is why you have seen errors in surgery. The surgery did not succeed. Patient continues to suffer because the kidney stone, the type of therapy, the type of surgery did not match with the size of the kidney stone. So this is all about creating awareness to everyone, to all stakeholders, clinicians, patients. They need to understand this clearly so we can help patients in this condition to live and manage this pain. Okay?
Okay, thank you so much, Dr. Okpala.
You're welcome, okay?
Dr. Butera, I think you had some questions.
I did. These disorders, you've mentioned that they do occur in children as well as adults. We understand from your wonderful presentation that it is genetic. Are these disorders more difficult to diagnose in adults or infants and children?
Well, they're just the same anyway. Yeah, you will expect this to be more difficult to diagnose on children, and that is because children are not really that kind of outspoken compared with adults. But the symptoms are obviously the same, whether children or adults. However, on children, we have seen 6 to 8%, more complications, compared with adults, right? So it's just the same symptoms, that kind of stuff. And you will expect this to be more difficult to diagnose on children. And it's because of their children anyway, they won't be able to tell you all that is going on, in their body, but yeah, it's on the same level.
Okay, one more question. So, you had said that, there are pharmacological as well as non-pharmacological treatments for these types of amino acid disorders. The non-pharmacological, of course, those are going to be a lifestyle change, in the way that you eat and you drink and what you consume. The non-pharmacological, are the side effects of some of the medications going to interfere with lifestyles of the patients?
No. So you're talking about, yeah, I think I got the question. So assuming someone is on this pharmacological, right? But the patient is still living his normal life, right? Are you asking whether this will interfere with the non-pharmacological, like hydration, right? That kind of stuff, right?
I guess, I understand the non-pharmacological solutions and treatments are
Right.
going to interfere with their normal day-to-day living, because you have to make a lifestyle change if you're not already doing that correctly, right? So if they are not doing that part of it as well, and they do need medications, are the medications going to interfere with their day-to-day lifestyle in any
No.
way? Are there side effects with the medications that may interfere with their quality of life, for example?
No, not really. Not really. That would not have any interference, but we always tell patient, if your medication, of course, medication cannot do all, right? There are some home remedies like this hydration, will help also, not us only, but the medication will not interfere with anything.
Thank you.
Welcome.
All right, Dr. Christie, I think you had a question.
Yes, Dr. Okpala, I was wondering, what was your motivation for this research?
Yeah, my motivation is to help patients in this kind of situation to manage their pain. Physicians have ignored patients' pain, resulting in this type of disease. So this is the time for us to begin to recognize that the pain is it is a very painful situation when someone gets this kind of stuff. And the thing here is that this is genetic. We don't really have treatment for this one, but I just my research is just to help patient to live, to manage this. If we manage this correctly, right, no one will live in pain, right, with this. So patient will know, okay, I have this, it's genetic, it's in my system, right? Now this should be my lifestyle, this should be my diet, and maybe I have to do checkups too, right, to see if there's anything else I have to do. So it's like someone managing, regular chronic type of disease, right, which they already know, and physician has told them this is what you need to be doing every day. So the same way with this one, patient will need to be able to manage this kind of disease.
Thank you.
All right. Do we have questions from anyone else in attendance? If you do, please just unmute and go ahead and ask your question. And I'll give you a second or two to do that. I know it might take a minute to unmute. All right. If we don't have any further questions, I want to thank you, Dr. Okpala. You did an excellent job. Thank you for kicking us off. This is awesome that we are starting this. I'm very excited that we're going to be able to have additional presentations. And I'm hopeful that faculty and staff that are here today, this will encourage you to go ahead and get your research together. We really want to see and hear from you on these presentations. We want to make this a very educational and deep thing that we're doing here at Charisma, and we welcome faculty, staff, students, and if you know someone outside of the university who may want to do a presentation, they are welcome as well. So if anyone has anything to add, I'm just giving folks a second to do that. Yay, thank you so much, Dr. Okpala. We appreciate it. And this recording is going to be available. We'll have it in our CTL, and we may see if we can put it on our homepage. It'll be on our Facebook and everything else. So we want to go ahead and promote the university and promote all the good things that are going on here. So thank you all so much. And we'll get additional
Thank you so
information.
much to all committee members, the members of CARI. Thank you so much. What you have done and what you're doing is good. Thank you so much. Appreciate that.
Thank you. Thank you. Everyone have a nice evening and weekend. Thank you so much. Bye.
Okay.